Thank you for engaging in this very important professional development on chronic illness, post-viral illness, and long COVID in kids. It is so important as educators that we know how to best support these children. Let's move on now to the area of what educators can do for prevention. What can educators do for prevention? Let's return to the first do no harm peanut allergy rule of thumb. What educators need to know about preventing peanut-induced anaphylaxis is to not allow peanut molecules into the body. What educators need to know about preventing long COVID, post-viral illness, and any airborne respiratory viral illnesses are to not allow airborne viruses into the body. The 3 C's of prevention are avoiding closed spaces, crowded spaces, and close contact settings. If you think about it, this is what our classrooms are. They're closed, crowded, and close contact. And that means we need to be very aware of the air quality and having fresh air as much as possible in our classrooms. I'm going to turn this section over to Jennifer, who will share with you the evidence-based information about how to obtain clean and fresh air for all.
Hi everyone. For those of you who haven't watched Module 2 yet, my name is Jennifer Thompson, and my family has been significantly impacted by the COVID infections my children brought home from school. I'm going to cover the clean and fresh air for all portion of the prevention module, and then Angela is going to cover the remaining sections. One of the most important forms of prevention is clean and fresh air for all. This isn't just for airborne viruses. It's also for bacteria, for smoke, for allergens, and more. Our bodies need clean and fresh air to be healthy. The benefits of clean air in school. It improves cognition and productivity. It improves test scores. It increases energy levels. It protects against outdoor air pollutants such as wildfire smoke and vehicle emissions. It decreases environmental triggers for students with asthma and allergies. It reduces spread of airborne diseases like influenza, RSV, COVID-19, and measles. As a teacher, being sick means making subplans that don't get done half of the time, and then having to reteach the lesson plans when you get back. When you have multiple students away sick, it means having to reteach lesson plans because too many students have fallen behind in class. This makes extra work for you. Clean air in schools will reduce this. So, what is the risk of getting COVID at school if we do nothing? Dr. Tara Moriarty has been creating info cards that can show you the risk in different scenarios. She is an infectious disease researcher and associate professor at the University of Toronto. She is also the co-founder and lead of COVID-19 Resources Canada, which is an academic-led organization that identifies and responds to community and research needs relating to COVID-19 in Canada. This is an info card she made for schools. It says, activity risk, 28 students, 2 teachers, 6 hours of school per day for a whole school year, poor ventilation, no mask or portable air cleaner. You have a 70% risk of getting COVID. Let's make our classrooms safer, keep masks on, and improve air quality. Masking and providing good, clean air reduce risk by 100-fold. The second info card shows the influenza versus COVID-19 deaths in Canada. As you can see, the COVID deaths in a 1-year period were still 12 times more than influenza in 2023. First and foremost, teachers deserve to be safe at their job, and students deserve a safe environment to learn and grow. Managing infection control should be the institution's responsibility. It is the school board's responsibility to make sure there is good ventilation in every school in the district. They are the ones who vote on how and where to spend the capital and operating budgets. The facility engineer is responsible for ensuring the schools are meeting the most up-to-date ASHRAE guidelines. The American Society of Heating, Refrigerating, and Air Conditioning Engineers published ASHRAE 241 in 2023, which is called Control of Infectious Aerosols. This is a code-enforceable standard to reduce the risk of airborne disease transmission in buildings. Now that we've covered clean air at the institution level, how can the rest of the school community help? Administrators. You can do your part by ensuring that HVAC in your school is maintained and working in accordance with manufacturer's operational guidelines. Teachers. You can improve the air in your classroom by using the WATCH acronym, which I will discuss in a few slides. Another great way to improve the air quality in your classroom is to arrange an in-class science project where the students build a do-it-yourself portable air cleaner. Then, as a class, measure and graph the air quality before and after. For this, you will need an air quality monitor that measures particulate matter. Once students see the big difference this can make on indoor air quality, have them sign up to take turns being in charge of turning the portable air cleaner on at the beginning of the day and off at the end of the day. This is a great way to empower students. Parents, students, and teachers can all contribute to clean air by staying home when sick. If you can't stay home, please wear a mask. On this slide are links to a lesson plan to build a do-it-yourself air cleaner and how to measure and chart the particulate matter in the classroom. Clean air in classrooms using ventilation and filtration. What should the school board and facility engineers' goals be for safer indoor air in schools? In late 2022, the Ontario Society of Professional Engineers put out 6 core recommendations for safer indoor air. First, we want to improve ventilation in our schools. This means replacing stagnant air with fresh air. We should be aiming for 6 air changes per hour or more for the mitigation of airborne diseases. As for improved filtration, filters get the particulate matter out of the air. Some examples: dust, dirt, smoke, mold, allergens, and viruses. Smaller particulate matter that can't be seen with the naked eye can get deep into your lungs and sometimes bloodstream. Improving filtration starts with the filter in the ventilation system. Your school should have MERV 13 to be able to filter out airborne respiratory infections. You can also improve filtration with portable air cleaners. They can be a commercially bought HEPA filter or a do-it-yourself Corsi Rosenthal box. Transparency and public education. How can a school be transparent about their air quality? They can publicly display CO2 and other air quality measurements. Transparency around indoor air quality will increase the public's trust. What would a teacher or parent do with the CO2 readings? They can use it to determine if the ventilation needs to be improved. We're going to look at 2 examples of CO2 readings in Alberta classrooms to determine if the CO2 levels are too high. In this example, the steady state CO2 is roughly 1,800 parts per million. I have assumed there is 28 6 to 11-year-olds in the elementary classroom. You can use the link on the slide to calculate the air changes per hour by entering this information, along with the size of the classroom and the outdoor CO2, which is currently around 420 parts per million. As you can see, the air quality in this classroom is poor. It is only getting 1.4 air changes per hour. In the second example, the steady state CO2 is roughly 1,160 parts per million. I have assumed there is 23 3 to 6-year-olds in the preschool classroom. Again, you can use the link on the slide to calculate the air changes per hour by entering this information. As you can see, the air quality in this classroom is poor too. It is only getting 2.2 air changes per hour. You may think these classrooms don't represent your typical classroom, but they do. Many classrooms across Alberta and Canada are only getting 1 to 3 air changes per hour. So, now that you know the CO2 levels are often too high, what can you, as a teacher, do? You can use the Clean Air in Classrooms Using Watch method created by Joey Fox, a professional engineer in Ontario. W stands for windows. You can open windows and doors at the same time to create a cross breeze. You can place a fan in an open window, blowing outside, making sure to have a second window open to bring in more outside air. A stands for air movement. You can check the air movement on the supply vent in your classroom with a string or tissue. T stands for thermostat. You can ensure the thermostat fan is set to on in your classroom. C stands for CO2 levels. You can take the class outside to give the ventilation system some time to bring the CO2 levels back down. When you get back to the class, you can measure the CO2 levels again. If the CO2 level is still too high, what can you do next? This brings us to the letter H, a HEPA filter or Corsi-Rosenthal box. You can use these portable air cleaners in your classroom, but make sure to place away from walls, corners, and open windows to get the most benefit. And you can submit a maintenance request to get the ventilation fixed if this is an ongoing problem in your classroom. Now, back to Angela to cover the remaining sections of the prevention module, starting with stay home when you're sick.
One of the key things that we can do for prevention is to stay home when you're sick. If you have any symptoms of airborne respiratory illnesses or gastric illnesses, it's really important to prevent spreading those germs and stay home when you're sick. We really need to develop comprehensive illness policies in schools. We need improved and transparent school-based illness prevention policies. We need improved and transparent illness policies for teachers and students. Stay home when you're sick. We need transparent reporting to parents and the community about absences due to illness. And we need transparent reporting to parents in the community about outbreaks so that everyone can be aware and make the best possible choices for their health and well-being. Absences from school greatly impact students and teachers with the ability to learn, to teach, and children and teachers often get sick at school and then bring these illnesses home to their families and out into the community. One study showed that 70% of COVID spread started with a child. Managing the spread of germs and viruses among children helps their growing bodies and still developing immune systems as well as the community. It's important to stop the spread of airborne respiratory viruses. A second important prevention approach is to wear an N95 mask or better. Current research shows that N95 masks and respirators are the most effective at stopping the spread of airborne respiratory illnesses. We need to develop comprehensive masking policies in schools. As educators, we need to recommend and model mask use, especially during respiratory illness season, during local outbreaks, and during school outbreaks. It doesn't mean that we have to mask all the time. It means that we have to be aware of when the highest risk times are and mask at those times to protect everyone. We need to normalize mask wearing for students. We need to consider masks as a medical tool like glasses. So students wear glasses so they can see better. Students wear masks so they can breathe better. We would never ask a student with glasses to take them off because we think they or their parents have anxiety. We need to not ask students why they're masking or think they need to take off their mask because we think they or their parents might have anxiety. We need to normalize mask wearing so that students feel safe, they feel comfortable, and that it just is a normal part of what they need to do to look after themselves and prevent illness. Another way to think of masking is they are a medical tool that allow children who are at risk for chronic illness, for long COVID, for airborne respiratory viruses, so they can attend school and engage with their peers. Here's another way to think of it. We've had a lot of fun with the game. The floor is lava. We need to think it is airborne. In the lab, COVID is a level 3 biohazard like yellow fever, West Nile virus, and tuberculosis. In schools, it's become no big deal. I don't think you can reconcile those two statements. If you want to keep updated on what is the risk of COVID in or anywhere in Canada, follow Dr. Tara Moriarty. She provides every few weeks a Canadian COVID-19 forecast and separates it by province as well. I didn't update the date for this because I don't know when you're going to be watching this presentation. However, you can see that she explains the risks very well. Explains how many people are affected, provides a COVID index score, and provides recommendations on how to prevent illness and how to help. So there are a number of resources that we used throughout this presentation. Let's Clear the Air, Alberta. So this website has wonderful updated resources for educators, for parents, for healthcare professionals. Long COVID Families has more information about supporting students with long COVID. Long COVID Kids is where the educational toolkits are with Pacing Penguins and Cautious Tortoise. Long COVID Physio has a long COVID video series. Supporting Children with ME/CFS, the Bateman Horn Center, and the Unrest movie is excellent to watch. It's really eye-opening. There's also Supporting Children with POTS, Supporting Children with MCAS, Supporting Children with PANS. And if you get the opportunity or take the opportunity to watch My Kid Is Not Crazy, A Search for Hope in the Face of Misdiagnosis, it again is really eye-opening on what parents and children face with challenging diagnoses. There's Stolen Childhood as well. Dr. Terry Moriarty, I spoke about. There's COVID Safety for Schools, Keeping Kids in School with Clean Air. There's the Indoor Air Quality Reports from the Ontario Society of Professional Engineers. And there's the Canadian Aerosol Transmission Coalition Mask Smart presentations. Thank you so much for taking the time to watch this important professional development presentation about what you can do as an educator to support children with chronic illness, post-viral illness, and long COVID. Mask up.